Electronic medical records are, in a lot of ways, I think, the aspect of technology that is going to revolutionize the way we deliver care. And it's not just that we will be able to collect information. It's that everyone involved in the healthcare enterprise will be able to use that information more effectively. The patient will be able to manage their own care because they will have the information about the results of their tests. They'll have information about the medicines that they're using. They'll have information about the effectiveness of various kinds of treatments. The physician and the healthcare providers, the nurse practitioners, all of the people that are involved in delivering care will be able to work more as a virtual team and use that information to connect what has gone on in the past in their patients' lives along with the care that they are delivering at the current time. And the healthcare system will be able to use that information to manage health resources over the entire population and to actually improve the quality of care by focusing on outcomes, focusing on the things that they can do as healthcare providers to improve the probability of those positive outcomes occurring. Increasingly, we know that we're going to have multiple medical conditions, and the person who's got the greatest incentive to manage those conditions is the patient, him or herself. The personalized medical record will provide a critical tool to be able to do that much more effectively than we've been able to do it in the past. In several cities where we have investments in the form of grants, we're beginning to see that all of the major healthcare providers in that region are using a common platform for sharing medical information. So what that means is that if a patient goes into the emergency room, the people in the emergency room can immediately call up onto a screen the results of the X-ray or the electrocardiogram or the laboratory tests that that patient got in the hospital or in the doctor's office a week ago. What that does is it gives the ability to manage that person's illness in real time in a much more effective way and to do it in a much more cost-efficient way because you're not duplicating tests that don't need to be duplicated. And you know the results of those tests that will greatly influence the care that needs to be delivered at that moment.